As we continue to recognize this Wellness Wednesday, we're looking deep into our medicine cabinet. Sarah Martinez from Kansas Care Connect joins us today to tell us more about common medication mistakes. Sarah, thank you so much for being here.
Yes, thanks for having me.
Of course. I know that, for a lot of us, if we have a lot of medication, it can be hard to handle sometimes. What common mistakes are you seeing and how can people just handle that?
Sure. Well, it's more and more, it's not uncommon. We're seeing patients that are trying to manage like 16 to 18 medications a day. I can barely get 2 vitamins in.
Yeah, no, me too.
So it's no wonder it's hard for them to manage. And then more and more patients are also seeing multiple providers. They're coming out of their appointments with new instructions, getting home and trying to navigate and track all of this stuff. And then you also have patients that are trying to manage their spouse's health on top of their own. So it's really easy for things to get overwhelming very quickly.
Yeah. So when it does get overwhelming like that, what do you just tell patients?
The best thing and the easiest thing that they can do is try to keep an up-to-date medication list with them at all times, especially if they're going to their doctor's appointments. That way they can provide that to all of their providers and they can all work off of the same information. That way we don't run into duplicate meds, meds that are in the same class, like having 3 hypertension meds instead of just the one that you should have.
Yeah, and a lot of meds, again, it can be very hard to handle. And what are just the negative effects of just making those mistakes?
Sure. Some things that could potentially happen is your medical problem could be overtreated, so your blood pressure could be way lower than it should be. Undertreated, so again, vice versa, your blood pressure could be higher than what it should be. You could get unintentional side effects from the medications that you're on, or even worst case scenario, we don't see it often, but you could even end up in having a hospital visit because of it.
Yeah, most definitely. We obviously don't want that at all.
No.
So very important to stay on top of all those things. And do you guys have any additional resources for those patients to just stay aware, maybe like online or something like that?
Sure. Really, the best resource is truthfully our Kansas Care Connect. Our nurses do monthly med reviews for all of our patients. And it's nice to have somebody who's watching your meds every month, making sure that things are accurate, can also provide education about the medicine that you're taking, and can correlate or correspond with all of your other providers to make sure things aren't falling through the cracks. We also have a pharmacist on staff that provides additional support for that too, for questions. He's even reached out to some patients directly to talk and answer some of their questions.
Yeah, most definitely. And just anything else that, patients should be aware of or anything that you want to tell them?
Probably the biggest thing is you're not alone. We know that this healthcare system is not the most patient-friendly, as odd as that sounds. And so there are people out there to help keep that list on you. Make sure that you ask the questions in your provider's offices. Make sure that you feel comfortable to speak up and don't leave until your questions are asked. And then reach out to us certainly if there's anything that we can help with.
A lot of great tips. Thank you so much, Sarah. We can always use that support. Thank you so much. Hey, go check out all the information on Kansas Care Connect. We have it online at cake.com/guest. In the meantime, we'll be right back.